Language by Haley Woods and Nicole Palmer. What is language? Based on the dictionary definition, language is a method of human communication, either spoken or written, consisting of the use of words in a structured and conventional way. It is ultimately a system in order for us to be able to communicate with each other. The speech-language pathologist's role. Obviously, it is the SLP's job to identify any children with language delays or disorders and provide services to those children. However, it is common to see an SLP in the classroom eliciting language with everyone. The SLP is likely trying to increase the use of language in the classroom from both the children and from the teachers. The teachers are amazing at their jobs, but sometimes they have so much going on in their day that they forget to label items as they use them, for example. This is where the SLP and the teachers can work together and increase the amount of language in the classroom as a unit. Do we care? It is critical to understand that the SLPs and the teachers can create the ultimate team when they work together. The issue lies where the SLPs and the teachers are both so busy that each professional simply does their job and moves on with their day. It is extremely important for both professions to take initiative and to create a bond between professions to benefit both sides. SLPs can help teachers improve language skills, reading skills, writing skills, and so much more in the classroom, while teachers can continue working on goals with the children in the classroom when the SLPs are not there.
Next, we will discuss a brief overview of what typical language development looks like in children from birth to age 5 and how teachers can play a role in helping to identify children that may have a language delay or disorder. Language development in young children can be separated into two different categories: expressive and receptive language. Expressive language is the words and language children use to express themselves, including their wants and needs. Receptive language is the understanding of language. Regarding expressive language, a child will typically say their first word around 12 months old. They will begin putting two words together from about 12 to 24 months old. At 3 to 4 years old, they'll begin to use pronouns, plurals, and sentences containing more than 4 words. From 4 to 5 years old, they'll begin to tell short stories, use verbs and sentences more often, and they'll be able to keep a conversation going. Regarding receptive language, around 12 months a child will begin to respond to basic requests such as "come here," and they'll recognize words for common items such as book, juice, and cup. From 12 to 24 months, the child will begin to follow simple commands and questions. 3 to 4 years old, they'll begin to answer WH word questions, such as questions that start with the words who, what, when, where, or why. And at 4 to 5 years, the child will begin to follow classroom directions, longer directions, and understand time words such as yesterday, today, and tomorrow. This slide helps to illustrate the roles that speech-language pathologists and teachers can play in identifying children that may be showing signs of a language delay or disorder. The SLP's job is to diagnose children with a language-based disorder and provide therapy for the child inside and out of the classroom. The SLP should help educate teachers about how they can help identify children who may be showing signs of a language-based problem. Teachers can help identify children in their classroom who they want to be evaluated by the SLP. Signs teachers can watch out for include straying from typical language development, difficulty expressing wants and needs through language, difficulty following directions, and difficulty learning how to read. Some problems associated with learning how to read can be language-based. It is important that teachers and speech pathologists work together so that children can receive intervention as soon as possible, so that the child is able to be a successful learner and communicator. As a teacher, you may have some bilingual children in your classroom. It is important to keep in mind that bilingual children develop language in the same way monolingual children do. In order to be diagnosed with a language disorder, a child must exhibit problems in both languages. Learning and speaking multiple languages will not confuse or harm a child. In fact, it is encouraged. If any of your students' parents indicate that they are concerned about speaking another language with their child at home, please tell them that that is okay and that will not confuse the child. As teachers of young children, it is important to expose your students to as much language in the classroom as possible. The following slide contains 5 strategies you can implement in your classroom on a daily basis. The first classroom language strategy listed is giving choices. Giving choices will make a child use richer language and vocabulary and show them that language is a useful tool to get what they want or need. Try to use the giving choices strategy instead of asking a child a question that they only need to respond to with yes or no. An example of giving choices is, do you want the green crayon or the blue crayon? The next strategy is the in sight but out of reach strategy. This also teaches children that language helps them get what they want. Teachers should put desirable toys and objects in a place that the children can see the toy but cannot reach it. Next is parallel talk and self-talk. They are similar strategies, but in parallel talk, you describe what the child is seeing or doing, and in self-talk, you describe what you are doing while in the presence of a child. In both strategies, you should not be expecting the child to respond, but simply just having them hear language is extremely important for your children's development. Next is expansion. Expansion is expanding the child's utterance by repeating the same information back to the child, but using adult grammar. An example is if the child says, "Doggy run," and the adult would expand on that utterance by saying, "Yes, the dog is running." These strategies will help expose your students to even more language use in the classroom and will help them learn a greater vocabulary and how language is a useful tool.